Welcome to Home Health Recharge on the Senior Rehab Project with your host, Troy Mead. Hello, I'm here with Devin Griffith to talk about the Hurricane Florence and its impact on the area of North Carolina and its employees in the area. Devin is the Vice President of Regional Development for Advanced Home Care, as well as he is the Foundation Chair for the Hurricane Florence Disaster Relief Fund for the home care and hospice employees from the Association of Home and Hospice Care of North Carolina. Thank you, Devin, for joining us.
Absolutely. Thank you for having me. I guess I'll start with just kind of giving a little bit of background on myself. Yes, I'm currently Vice President of Regional Development for Advanced Home Care. I actually have a master's in public administration and a master's in social work, and I've been in home care, healthcare for 26 years. Prior to coming to Advanced Home Care, I was a vice president at a small hospital system where I had responsibility for home health and our home and community care services, as well as case management, discharge planning, some outpatient and ambulatory services, and then some support services such as human resources and facilities. My passions in healthcare have been around palliative care, home care, hospice care, and really the transition from the acute care setting into home and community-based settings, and how interdisciplinary teams can work to really achieve the very best outcomes for patients in the home and community care setting. So I have been active with the Association for Home and Hospice Care of North Carolina for some time, and really pleased to serve on that board and the work that that association does, as well as being chair of the foundation, which established this Hurricane Relief Fund to really help home care and hospice employees that were impacted by Hurricane Florence in North and South Carolina.
It's probably still fresh in our minds, but Hurricane Florence hit the North Carolina coast in September of this year. It's been estimated that it's done over $16.7 billion of damage to the area. So to start off, could you tell me a little bit more about the foundation and why it was created?
Absolutely. Not all of the state home care and hospice associations have a foundation. We are very fortunate in North Carolina to have a foundation that was actually established in 1998. And some of our primary purposes of this foundation is really to enhance community awareness of hospice and home care options, really outwardly focusing to educate consumers, policymakers, and the public at large about hospice and home care industry. There's still a lot of misinformation that's out there, and people don't necessarily know how to access the care that they need and the options that are available to them. And then our third element is really to conduct workforce improvement studies focused on hospice and home care programs. So part of this is really to provide workforce development, training, and other assistance to hospice and home care service providers, as well as the various professionals such as therapists and other disciplines that were really critical to the provision of home care services. We are actually in the middle of a grant right now to fund really building the pipeline of nurses going into home and hospice care, and really working with community colleges and our educational institutions so that they can create labs for home care, for hospice, and really have a much broader and more robust outreach programs and collaborations with home and hospice care providers in different communities across the state. So this foundation is really a passion of mine. I think that there are lots of opportunities, both in terms of supporting workforce improvement studies, but also just generally educating the community and the public at large about home and community-based services.
It seems there was a need that was identified when Florence went through the area, not only for our patients, but for the employees that work in these areas as well. So with the fund that you raised, how many people have you helped?
Yeah, we've really had overwhelming support, probably more support than maybe we initially expected. At this point, we have been able to raise $54,000, and all of this money, 100% of it, of their donation, is going to meet the needs of home care and hospice employees in North and South Carolina who were impacted by the hurricane, which we're real proud of, because that means that 100% of all the administrative costs are really being borne by the association and the foundation, and it's 100% passed through to the people who need it the most. The other thing that we really set as a priority was when we have the donations, when we receive the request from home care and hospice employees, we literally turn around the assistance in 1 week. So they're getting a check to them in 1 week, and we know that it's not necessarily to the amount that maybe FEMA or any state or federal entity might provide them, but we also know that that takes extensive amount of time, paperwork, and a process, and we really wanted to make sure that the relief went to the people who really needed it, and the relief went there as fast as possible. So at this point, we've been able to assist over 130 home care and hospice employees who were impacted by the hurricane. The relief amounts range from anywhere from $100 up to $500. So we did really try to set some standards and ways that we can administer this fairly and administer it quickly to get the relief out to the people who certainly need this support.
Do you have any examples of those that you've supported with the funds?
Yes. I think for all of us, seeing these requests, but also talking to the people who have been impacted by this hurricane, you realize how pervasive and how impactful and how devastating this hurricane has been. And certainly what we know is that the relief efforts and the recovery efforts, this is really years with some of the devastation. And as we all know, Hurricane Florence just traveled at 2 miles per hour. So the amount of rain that was experienced by some of these communities really were really devastating amounts. And so, as we all know, water's insidious. It goes wherever it wants to go, and the impact really has been devastating. We have had home care and hospice employees who have literally lost everything. Now, certainly, there's one woman that stands out, a nurse who is in Eastern North Carolina. Her entire home was flooded, and it's a complete loss. Basically, that family lost everything, and she was displaced, her husband, her 2 children, and the only thing that they were able to save was their children's clothes and a few personal items. And so here's a family that, given the situation, they are living with their parents until they can find other living arrangements, because that house is not going to be something, that family home is not going to be something that they're able to ever go back to in terms of being able to live in. We've had other people that have just lost all their food, and with the power situation, also that they've been impacted with parts of their house that have been underwater for extended periods of time, and then they had to evacuate. So they also lost wages, they lost personal items, they weren't able, for some of these individuals, and many of us, we live paycheck to paycheck. We have the bills that are coming in, and if we're not able to work because we don't have stable shelter, then we also lose that income. And so for many of these individuals, things were already financially tight before the storm, and now they've really become in dire financial need. And especially if we think about our interdisciplinary team members, how many home care aides are really essential to the care that's being provided by home health and hospice organizations. Already, many of them have been living paycheck to paycheck. But we've had people that some of them have been displaced out of state to be with family and be with relatives, and they were literally gone for several weeks before they could return. These accounts and these stories are really devastating and heart-wrenching. And in the same respect, what we've heard back from people was, "Oh, thank you so much." You never can underestimate what a check of $400 or $500 can mean to somebody who is so stretched, so thin, and as at a point in their life where any type of relief can really make a difference for them at that point in time.
Yeah, you don't think about it until it happens, right? I think it feels good, though, as a North Carolina home health clinician, that there is so much support from our state agency, as well as it was picked up pretty well by our nationals to help support the foundation. Though it hit more on the eastern side, it didn't hit, because I'm a little bit more central, it didn't hit me personally as much as it did my colleagues over on the coast. What are some ways that I, as a therapist, can help support the foundation, as well as the association, in helping our fellow therapists, nurses, aides?
Absolutely. And I do want to share that the national support for this Hurricane Relief Fund has really been tremendous, and that has included the National Association of Home Care, who also really made a very nice and significant donation to the Hurricane Relief Fund. If you go on our website, that's www.ahhcnc.org, you'll see right there the Hurricane Relief Fund. You can click right on there, and there's an easy way to make a donation. Literally at this point, most of the money that we have received has gone out. We have additional requests that are coming in, and we are working on meeting those additional requests. And I think through all of this, we know that this is going to be a long process, so the needs will be there for a great deal of time. So we are continuing to send out calls to make sure that we have this Hurricane Relief Fund for some time to really support our home care and our hospice employees and their families who have really been impacted. I think on the other side of things, I think therapists bring such an incredible skill set to our disabled and our seniors and families. And really, if you think about the displacement right now of families, and while I've been talking a lot about staff, there's also been an awful lot of displacement of our seniors and our disabled individuals who really need care in the home and depend on care in the home. And they've had to go to new residences and now are adjusting to living with physical issues in a new home setting or new community setting. And I think there's tremendous need for therapists to help them with adjusting to that new care setting or that new residence. making sure that their safety needs are being addressed, and making sure that as many of them, are going in and out of the hospital and coming back into the home setting, that they have the support that they need. And I think as therapists too, there's an awful lot of opportunity to really identify things like post-traumatic stress disorder, depression, anxiety, and be able to ask some basic questions in terms of the assessment of that, and be able to refer that to the social worker or to another community resource, because certainly we know there's the physical displacement, but all of this has also caused a whole lot of post-traumatic stress, anxiety, depression, loss, and grief for individuals who are adjusting to this change and transition.
That's a great perspective. And for those of you who want to contribute, as Devin mentioned, I'll put the link to the website in the show notes. Devin, is there anything else that you would like to add?
Yeah, I think just lastly, I've got a quote here from the great peacemaker Gandhi, who said, "Where there is love, there is life, and the best way to find yourself is to lose yourself in the service of others." And I think these words are really a testament to the creed that home care, home health, and hospice and palliative care staff live by daily, and in the service of patients and families. And what we're really seeing is that people are really supporting others in need. They're really true to their commitment to service, and really making a difference in the lives of others in need and who have been impacted significantly by Hurricane Florence. So I'm really proud of the donations and the fact that we have been able to offer some level of relief and support for people who have been really just so significantly impacted by this.
Well, Devin, I want to thank you for your service with the organization, your help, and I want to say I'm thankful for the organization itself as well, and the foundation and the support that they've given us. Thank you for joining us. Thank you for listening to the Senior Rehab Project. If you gained from this episode, consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month or become a game changer for $8.99 a month, where you get this awesome redefined old mug and access to our monthly meetups. They're really a blast. Just go to theseniorrehabproject.com to learn more and find the show notes for this episode. Talk to you soon, and don't forget to stay funky.